The views expressed in this podcast do not reflect those of our training institutions or the APA. The information discussed is intended for educational purposes only and should not be used for diagnosis or treatment. Enjoy.
Hello, welcome to the American Journal of Psychiatry Residents Journal podcast. I'm Barrington Hwang, and I'm one of the media editors, and I'm here with Priya, one of our other media editors.
Hi everyone, it's Priya Gearin. So Barrington and I today, we were going to just spend some time talking about some of the recent articles in our March edition of the AJP Residents Journal. Barrington, where should we begin?
Yeah, I remember reading a bunch of these articles, and I looked at one that particularly caught my eye, the SSRI-induced hypersexuality, and I guess I usually associate SSRI, sexual-related changes, as hyposexuality, but this brought up interesting case reports of hypersexuality. And so I think, for me at least, that's a very common medication that we prescribe, but have to keep in mind some of these other things. But also, for me, it shows we're still learning a lot about many medications, and while we know a lot, right now there's still a lot to go. What about you, Priya? What have you found interesting?
Yeah, that one caught my attention too, for the same reasons. And I think the case report they described for the SSRI hypersexuality was a patient who actually had a thyroidectomy, if I'm recalling. So I wonder too if there's a hormonal piece, a lot to still, I think, learn about that. But yeah, actually, the neurosyphilis with psychosis is the primary presentation. That was also a pretty interesting case study. And, in this one, they describe a case, a 67-year-old woman who had been misdiagnosed with late onset schizophrenia 8 years prior. She had been having some bizarre behaviors and paranoia. But when she finally ended up at their hospital, they, did some blood work, revealed an RPR with a positive titer, ended up doing an LP, and ultimately she was treated with IV penicillin for neurosyphilis and had some improvement in some symptoms. So I think definitely take a look at that case report and that discussion. The authors do a really good job of providing some details about, the appropriate workup for psychosis in elderly patients, the treatment for neurosyphilis, the prognosis as well. And I also felt they did a really nice, just general overview of syphilis. I think we all remember from medical school the stages of syphilis and trying to memorize all the different symptoms and, what is neurosyphilis? How does that fall into it? So they do a good job of outlining all that.
Yeah, that was definitely interesting to read as well. I know in the first episode workup, usually there's RPR and many other labs, and for it to come back positive is always interesting because usually we get all these labs for a reason, and you don't always expect them all to come back.
Yeah, definitely. What else, Barrington? Any others that you felt were interesting?
Yeah, I know there's the one in sports, and we should have another sports episode podcast on head injuries and concussions. And so I really found it interesting the changes in athletes, especially after head injuries in sports, and how we need a lot more information and research surrounding that. It is interesting also because sports are integrated into our culture so much and youth, and it's a way to have team building. And so I think learning about this on a population level, not just with our individual patients, I think it'll be really important moving forward.
Yeah. Are you going to be the one coming out with the new episode about the TBIs?
Yeah, it's me and then another resident, Dr. Sagarwala, and then one of our med students, Evan Watkins. We're going to interview Dr. Jekyll here. He works with many sports teams here in the area, and he will be sharing his experience.
Very cool. Well, that's pretty timely and fits right in with this article. There were a couple of articles on telemedicine and telepsychiatry, and particularly related to psychiatry training. As a current third-year resident doing most of my time in the outpatient clinic and doing a lot of telehealth, I could definitely relate to what these authors described. And I think, like many have already covered in other, discussions, there's a lot of pros and a lot of cons maybe to telepsych. And I think one thing that I'm, realizing, especially as the year is starting to come to an end, most of my patients I've never even met in person, and I probably will never meet in person. So, and at the same time, I feel like I know them very well, and we've shared a lot over these past almost 12 months. So definitely a unique time to be training. That's for sure.
And I bet you've seen them in a bunch of different situations, at home, at work, walking their pets, probably other situations too.
Absolutely. And that kind of is brings up a good point. I think we're seeing, at least in my experience, patients that we normally wouldn't be seeing in other, situations, meaning there are sometimes, I think, people who otherwise would feel too depressed, too unmotivated to make it into the clinic, or too, disorganized, whatever might be going on psychiatrically. And, but they're still able to pick up the phone or log on to a video call. So we're really meeting people where they're at this year in new and uncharted ways.
Yeah. All interesting stuff. Well, I know there's many other articles. One about history, about the father of college psychiatry. There's also one about creative arts and psychiatry. The last bit is on the call for applications for the next academic year's editorial board. So I look forward to seeing who's applied, and for all the people that have applied, I send y'all my good wishes, and hope it's a long journey of learning in psychiatry.
All right, Barrington. Well, I'm glad we took a few minutes today to discuss just a few of the articles in the most recent March edition of the AJP Residents Journal. Definitely would encourage our listeners to check that out on our website. We can also find it on our social media sites, Instagram, Facebook, Twitter, to learn more about some of these articles we've talked about and to read others. So until next time, hope everyone stays well, and we'll see you later.